Hey there, it's Dr. Tom with EBM Fitness Solutions, and in this video series I'm going to walk you through some reasons why you might be having some back pain during squats. Now, a couple of things real quick. If you're having constant back pain, then it's clearly not directly tied to squats, so be very careful with how you apply this information. Now, the other thing about squats are not bad. In and of themselves, it's a great exercise. Doing the wrong kind of squat with the wrong technique, with the wrong setup can take a good thing and start to make it not so great for you, and it can be a one-way ticket to having some different issues with your low back pain. So if you're having back pain with primarily just when you squat or after you squat or something like that, then this video series is going to help take you through some different causes and then give you some strategies to help get you out of low back pain. Before we get too far, the one thing I want to mention about this video series and this information is that it's going to work best for you if the type of pain you're experiencing is chronic pain, or the kind of pain that's been there a while, but you don't know how it started, right? It may be like, I don't know, it just started happening one day. That's the kind of pain we're talking about. If you recently hurt your back, this information, although still beneficial, may not apply to you yet. Acute injuries and chronic injuries are a little bit different. So if you just hurt yourself, you need to go get checked out to make sure you didn't actually damage something worse than you think before you start applying this information. Another thing too, the type of pain that I'm generally referring to in this series is pain that stays in your low back, okay? Anywhere kind of across or one side versus the other. If you have radiating pain that shoots down your leg, even if it just goes into your butt, if it starts going anywhere down the body from your back, then you should be evaluated by a skilled clinician. It doesn't mean that you can't squat and that you can't do things, but it needs to be under the guidance of a skilled professional, a skilled clinician who knows what they're doing and knows how to help modify what you're doing to avoid making that worse. When you have pain that goes down the body from your back into your butt or anywhere down the leg, you're compressing nerves, right? So we don't want to mess with that. So make sure if you have that pain, bookmark this for later, go get checked out, make sure that you know exactly what you're dealing with before you move ahead with trying to squat or do too many other exercises just in a general sense. So let's talk about some pain rules or things that you need to pay attention to if you are exercising with pain, because the rules are different than when you're just doing a regular workout. So if you have low level pain, and we're going to use a pain scale because pain is very subjective. So, somebody's 3 out of 10 is going to be very different than somebody else's. But generally speaking, if you're feeling pain and it's say 3 or 4 out of 10, so on the lower side of things, if you do a movement and your pain stays at the same, at that 3 or 4, generally speaking, it's going to be safe to do because it's not directly irritating the problem. If your 3 or 4 starts to climb up 5, 6, 7, whatever, then you got to stop what you're doing right away, because that means the movement you're doing or the thing you're trying to do is directly causing irritation to the problem. It's making it worse. You can't do that thing. Now with squats, a certain type of squat, for example, a back squat might increase your pain, but a goblet squat or other kind of squat may not increase your pain. So sometimes it's not that we throw out the entire exercise. It might be that we need to modify, make some kind of adjustment to what you're doing. So that's very important too, but if it makes it worse, you gotta stop doing it. Your goal should also be to manage your fatigue, not induce fatigue. When you're dealing with pain, the rules are different. That is not the time to beat the bag out of yourself and run through a really tough workout. Your mindset and your approach has to change to get you out of pain. So sets and reps, everything's gonna be condensed down. Volume's gonna be a lot lower because your goal, there's 3 things that you wanna do, is you wanna feel good during the workout, you wanna feel good later that day, and you wanna feel good the next day. Meaning when I say good, that's no increased pain. So if you have pain during the workout, but it stays at 3 or 4, that's fine. Later that day, it's gotta stay. The next day, it's gotta stay. Ideally, it would decrease, but it cannot increase. If it increases, that means what you did, even if you reduce the volume and it still hurts, something was wrong. Whether it's your technique, whether it's you still did too much volume, even if you cut your volume in half and you still have pain, even though mentally you think, well, I'm not doing as much, it's still too much as far as the tissues in your body is concerned. You have to pull it back even more. So the rules are different when it comes to volume and things like that. in rest periods. You're not trying to get a good workout. You're trying to work out without pain. It's two very different things. You'll get back to doing the other stuff, assuming you handle this stuff correctly. But if you jump ahead and just start pounding yourself with hard workouts like you've always done, you're never going to get yourself out of pain. The reason you want to keep things low is that when you've had chronic pain, your body becomes hypersensitive to things. So you have a very low threshold for irritating tissues and sort of kicking up inflammation and starting that kind of process all over again. So you have very little wiggle room to do something wrong. As you go through the process and you rehab the right way, you essentially increase your threshold, which allows you to do more before you trigger a negative response. In the beginning, most people have such a low threshold that they do one little thing wrong, and then there's increased inflammation, pain, maybe swelling, and then that knocks them back for days, sometimes weeks. So you have to go into it with a certain approach. You want to stay below that radar, below that line. Don't do things that kick you above that are going to kind of kick up your symptoms. Stay low, change the mindset, make your focus about doing what you can to stay out of pain, not just doing a whole bunch of stuff because that's what you always have done. That's going to keep you in pain and never let you progress and get back to doing those things you want to do without pain. So let's talk about where in the squat you might be first noticing the pain. So let's talk about on the way down. So you're set up to do a squat, and on the way down to that bottom position, that's where you first notice some pain. What's going on there? What could be the problem there? The first thing we want to look at is poor sort of motion at the hips. A lot of people, even if they've been exercising for years, really struggle to move well through their hips, to really hinge at their hip when they're doing all sorts of things, squats, deadlifts, lunges, you name it. They don't get the hips moving, so it becomes very knee focused. And yes, the squats are more of a knee dominant type motion, but you still need to get the hips moving, and the glutes have to be big time contributors to the motion. So what should happen, this is a great tool, by the way, to help figure out if you're hinging like you're supposed to with a lot of different movements. Almost impossible to do with any kind of a load, but just as a general sense and a mechanical thing, what you want, if I hold the stick on my back, it should touch right around my tailbone, right in between my shoulder blades and the back of my head. So when people are very knee-centric, right, what they do is they get their knees going forward this way, and I lose the middle contact point with my back, right? What I should have is something like this, where I keep those three contact points as I move. It's a great tool for beginners to learn how to move through their hips without kind of bending and moving their spine all around the place. So most people struggle with a hip hinge. To really get the hips moving, ideally you want the hips and knees kind of working together, but you got to get your butt going back. Sometimes people push it back and then immediately push it back forward. They become very sort of focused on the knees, very little sort of on the hips and the glutes. That's one of the first things. That feeds right into the second problem. Most individuals have very tight ankles. Their ankle mobility is poor. And if I use my hips properly, my ankles have to bend and move a little bit, but I don't ask as much of them as when I push my knees forward. If you have poor ankle mobility, you're going to basically use that up very quickly, and then that feeds into sort of other problems too. So if I go here and it pushes here, I'm going to put a ton of stress at my ankles. Now, ankles and hips are actually kind of linked for different balance strategies in the body. So for some people, once they do this, they automatically kind of get right up into the hips and the low back, as far as kind of like they fold. So it kind of becomes more like this motion. Other times, what people will do when they run out of ankle motion is their heels kind of pop up. So they're able to kind of hold this position okay up top, but their heels are up. Typically, when your heels come up, you get a couple things. A, your ankles from an anatomical standpoint are the most unstable when your heels are elevated. The ligaments are most lax, you're most likely to have a lot of movement at the ankle joint. That's one. Two, it's very difficult, damn near impossible, to fire your glutes when your hips are up like this. It's tough to get them to do anything. So now the thing that we wanted you to use in the beginning, you've essentially shut off by getting your knees too far forward. They're not helping like they should. Then the other problem, and all these things feed right up into your low back, is that if you do end up this way, that's one thing, but some people, if they're here, they actually will then fight to do this. So now they excessively arch through the spine, especially the low back, in an attempt to balance their body weight, because toes are up, too much of my weight's going this way. So if I arch my back, I kind of bring myself back to balance myself. It's a horrible strategy, but it's what your body will attempt to do to keep you balanced. Body weight, it's fine, but imagine if you have a bar on your back, right? And now I'm being very dramatic with my motion. You may not be that dramatic, but still, if you're in the bottom position under load and all of a sudden you're getting this, yeah, that's not allowing your spine to absorb that force very well. Instead of it being distributed, it's being focused. And it's going to be focused in the low back. So a lot of this pain that you feel coming down, it starts at the hips. If you get better at hip hinging, it's going to take stress off all the other things. But looking at ankle mobility and other things is not a bad idea, but start with the hip hinge, and obviously start with a lot lighter weight, work on the technique. We'll give you some other strategies in terms of how to do that coming up in the next few videos. So let's say you're coming down in the squat and everything is great, but it's when you start to make your way back up to the top, that's when you first notice the pain, or you have the most pain when you squat. What's going on there? How do we make sense of that? So a lot of times, pain on the way back up starts at the bottom. What a lot of people do in a lot of exercises, not just squats, but it's pretty apparent with squats, is when they change directions, right? So every exercise has a point where you go from one direction to another, you change and you go the other way. That transition point where we kind of switch from eccentric to concentric muscle contractions, that is a common breakdown point for technique. People lose their tension, the focus, just they kind of lose things just for a second, and it throws everything off. So a lot of times with the pain coming up, it's because when the person gets to the bottom, they kind of, for a second there, as they change direction, they lose the ability to hold their abs tight, they lose the ability to keep total body tension, and then it can cause the bar to shift forward a little bit, which then opens up the low back, and they might fix it by the time they get back to the top, but still, that bottom loaded position, they're allowing the spine and they're allowing the body to shift and move around, which opens up the low back for some unnecessary stress. Now, sometimes that transition is made more difficult because the person just dive bombs from the top. So they from here, they kind of they drop into it, giving themselves no chance to set stability or have any control over that negative or eccentric portion of the motion. So if you kind of find that you're almost dropping like a trap door let out underneath you during your squat, give yourself a chance, go a little slower. So make sure you control the descent, keep the tension, and squeeze and drive back up, and do it more in a controlled manner. Because another thing that tends to happen from the bottom is when people try to explode up, their low back starts the motion, not their hips, right? So when you get to the bottom position here, when they go to come up, they get this, right? So their low back kind of drives, and then the hips they eventually kind of do their thing, but it starts with the low back. And in that position, those low back muscles are not meant to be movers like that, especially not with any kind of a load. They're stabilizers. They're meant to hold your posture and hold your spine in more of an extended position, not to create forceful movement against a load like that. So focus on good controlled descent, keeping things tight at the bottom, and make the transition smooth on the way back up. A lot of times this means you have to lighten your weight and really work on your technique. But if you're sloppy in that bottom position, the weight might be too heavy, and that might be a part of the problem in the first place. So let's say you squat down, feel good, you squat coming back up, feels good. So during the workout, everything feels pretty good. Let's say it's maybe later that day or the next couple days after, your back's kind of crabbing at you because every time I squat, my back hurts. So this is a little bit different. It's typically more muscular in nature, meaning that it could be technique. All the things we talked about, from the things that you could do sort of on the way down, things you could do on the way back up. All those things absolutely pertain to contributing to this part as well. But now you're looking at the volume, right? So sets and reps, how much weight you're using. Those things now become bigger factors too, because soreness typically comes from volume, right? If you do 5 squats, even with a heavy load, you're probably not going to be that sore. But if you do 50 squats with a decent load, there's a very good chance that you're going to be sore, not in a bad way, just generally speaking. So volume is typically what makes people sore. So when things are sore afterwards, we look at, all right, well, how much am I doing, and then how am I doing it, right? Because it comes down to technique and also the type of squat you're doing. If you're forcing yourself to do barbell back squats with a straight bar, that could be part of your problem. We're going to talk about setup in the next video, but sometimes it's not the squat, it's the type of squat. Not that squatting's bad, but maybe for you the straight bar is not good. Maybe a yoke bar or a safety bar that has the handles out front, maybe that's better for you. Maybe goblet squats, maybe front squats. Maybe try a different type of squat to help alleviate some of the pain afterwards. Maybe cut back your volume a little bit, right? If your legs aren't that sore, but your spine is kind of sore and your back is hurting, something's not right there. You know, most of the work should be done through the legs, quads, glutes. Now, here's the thing though, you do have muscles in your low back and all along the spine. So yes, they do get worked and some minor tightness once in a while, not a horrible thing. But if it's pretty consistent, like every time you squat, you feel your back afterwards, then that's not a coincidence. That means there's something you're doing, whether it's the type of squat you're doing, the sets and reps, the weight, the overall volume, something has to be addressed. Maybe in addition to some of the other things we've already touched upon in terms of, you know, the transition from the bottom to the top, those kind of things. But take a look at those things and really kind of break down what you're doing, but understand that chronic pain afterwards in the low back with squatting is not normal, it's not okay, it's something that you definitely want to address. One of the biggest reasons people have pain when they squat in their low back or anywhere else for that reason is they're setting up poorly. And the setup could be the type of squat they're choosing, or that they're forcing their feet, the width and sort of the toe position, if you will. They're forcing themselves to do something that doesn't work for them. Now, I won't kind of go too crazy on this point. There's been a lot of people written about this before, so I'll touch on it briefly. But there's a lot of difference between hip anatomy from person to person. So you have your thigh bone, your femur. At the top of it, you have what's called the femoral neck. At the end of that, there's the ball, the head of the femur that plugs into the socket of the hip, okay? So the angle of this right here, where this comes up and angles over, that angle is different in a lot of people. Some people might be the same, but the point is, you grab 10 people, they could have 10 slightly different angles of that neck, just that part alone. Then you have the socket. Well, the socket can be positioned in a slightly more towards the front, more towards the side position. And the thing is, you can't fix that. You can't control that. You can't change that. So, but what you can change is your stance, you know, sort of how you set up for the squat. And if you force yourself to do the wrong kind of a squat, then it's going to hurt. And that's just how it is. So something to keep in mind too, if you're squatting a certain way and you feel pinching in your groin area, that is where the ball and socket joint actually is located. So your hip bones are out here. Yes, that's true. But that's not your hip joint. Your hip joint is right in the groin area. So if you're squatting down and you feel like a pinching or a pulling or something going on in the groin area, what you're probably doing is you're basically bumping up against your own anatomy. Your hip, the ball here is basically banging up against the socket because the position you're in doesn't work for your body. So first thing you want to do with your squat is fix your setup. So what I would encourage you to do with either no weight, so a body weight squat, or very, very light weight, to play around with different setups. Go with a narrow stance and do some there. Turn your toes out with a narrow stance and see how that feels. Go with a wider stance with your toes pointing straight ahead. Go with a wider stance with your toes pointing out. You could even, because there is, for a lot of people, you will have a difference between your right and left hip. All those things I mentioned, so the angle and the position of the socket could be different from your left to your right side. So you may find that if you have a staggered stance, or maybe you have your feet kind of set up but one toe is turned out more than the other. The point is, you should experiment and find out what works best for you for your setup. And if anybody tells you that you have to do it a different way, tell them to go screw, because they don't know what they're talking about. Everybody's squat setup is going to be a little bit different, or can be a little bit different. And forcing somebody to go with a narrow toes forward stance might just wreck their hips and wreck their low back, and it makes the squat look like it's a bad thing. It's not. It's perfectly fine. You just didn't set up correctly. So if you're having low back pain with squats, as you work through some of the other things we've talked about in terms of the transition and keeping tension, try a different stance. And then to that point too, don't force depth. Okay, not everybody will squat all the way down, commonly referred to as ass to grass squats, where you basically go all the way down and kind of put your butt right on your heels, right? So a couple things to keep in mind, that not everybody's anatomy will let them do that under load, okay? Squatting down with just body weight and doing that, okay, still some people are going to struggle doing that. So forcing somebody to try to squat deeper than they can go is going to increase pain in the knees potentially, the hips, and absolutely your low back. Because once your hips stop moving, the next part of the body to step up and try to do some moving is your spine. That's going to try to take over, and it's going to try, whether it arches excessively or flexes forward, it's going to try to do what you're asking it to do, even if it can't do it. So don't force depth. Find what feels comfortable to you. And once you find it, use a box or use a bench or use something behind you so that every time you come down, you find that sweet spot and it feels good. The motion itself feels good. Then you can load it, you can work from there, but don't force things. Don't force your stance into a certain way because somebody said you have to. Don't force your depth because somebody said that you have to, because you don't. Because that person doesn't know what your anatomy is, and it doesn't make it, your squats are somehow inferior because you're not squatting all the way down. Some people can. Some people can, and they can maintain great mechanics all the way down. Most people cannot. They're going to have some sort of a limitation somewhere, so don't force it. You're only going to make it worse. You're going to end up hurting something really in a major way. So find what works for you. Play around with a lot of different things, and when you find the thing that works, stick with that and repeat that, and then you can try all different types of squats, goblet squats, front squats, straight bar, barbell squats. You can try whatever you want once you have the setup right, but spend time first, nail down your setup, and then start to work with that. I think that alone is going to make the squats feel better on your body and reduce the incidence of low back pain. So in the last video, I talked a lot about setup and the anatomy and how you really can't change those things, so you kind of find something that works. But you can have soft tissue restrictions that are going to limit your squat. So how do you know is whether or not you have a sort of a bone, a block of your anatomy that you can't fix versus a soft tissue restriction that maybe you can? And that's where deloading comes in. So take a look at these two videos here to show you how you can deload using both pulleys and bands. Deloading is great because what it does is it helps us figure out if the limitation is from joint or whether the limitation is from soft tissue. So if you squat down just regular body weight and you get to a point and you kind of get stuck, okay, what does that mean? Could mean a couple things. But if you deload the movement and all of a sudden now you can drop further into your squat, then the joints have plenty of range of motion that you can go through. You're just not able to access it actively. So that's great information. So that says, no, you don't have a limitation here. You have a limitation from a movement standpoint, a muscular or a neuromuscular standpoint, where your body is sort of creating a block of sorts. It's not letting you go because maybe it's sensing something in your body it doesn't quite like. So it's saying, you know what, stop right here. So it's putting the brakes on for a reason, but the deload can help you kind of both assess your ability to do something, and it also can be the first step in sort of rehabbing that motion. And actually, you can start using the deloaded squat as part of your rehab or as part of your training. It also decompresses your spine a little bit, right? So if you think about a bar on your back, that's going to compress things. The deload, because you're holding on, it's going to kind of create a little bit of attraction to your back. So sometimes doing the deloaded squat, the back feels awesome while you're doing it, and you're able to squat through more range of motion, which is a win-win. The pain goes away or decreases significantly, and you have more available range of motion. That's great for you. So definitely, if you're having pain when you squat, try doing some body weight movements to assess where you can get to, and then assess that compared to your deload. And if the deload makes it better, great, then that gives you some valuable information to move forward with. Start with the deload as part of your, even if it's a bit of a warm-up, I would use that as how you squat, at least temporarily, to work on the other pieces we talked about. work on keeping your body tight, right? Get your lats tight, get your abs tight, and then work on coming down and work on controlling that descent. The band's or the pulley will help to lift you back up, but work on maintaining your tension as you go through the motion. So all the things that we talked about so far can be practiced and utilized in the deload, which is great. So if you're able to work on your technique, go through more range of motion, and have less pain, that is a slam dunk way to start squatting. And if you practice those things, then take it from the deload to body weight, to goblet, to front or back squats, but you kind of walk through that progression, then you can get back to squatting, good weight, but not have the back pain because you've addressed these things along the way as you ramped back up to what you were doing when you did have the pain. So start with the deload as an assessment, but use it as sort of the entry point for starting to work on your overall squat mechanics. So let's talk about your abs and the work that they're not doing during the squat. Now, treating low back pain is very difficult. It's very hard to do. It requires a lot of time, a lot of effort, and usually it involves more than just working on the low back. There's a lot of other lifestyle things that typically have to go into resolving low back pain. But specifically when we talk about squats, your abs have to be a big part of stabilizing the middle part of your body. And for most people, they don't. They're very poor at that. So you have to look at core stability and building up sort of ab stability separately, sort of individually, and as part of the squat. You can't just do it during the squat. Chances are, if you're not doing it now, there's probably a deficiency there that needs to be addressed individually, and then also as part of the overall squat plan. So if you're already kind of strong and you're having some low back pain, sometimes doing the introductory core stabilization movements seem like they're too easy and not worth it. That's incorrect. They are worth it, and just because you don't feel it while you're doing it doesn't mean that it's too easy. It means you need to work harder to feel what you're doing. So you need to spend time working on some basic movements, but then also ramp up your overall kind of ab and core strengthening just in general, but more from a stability standpoint, not so much about creating movement, whether it's rotation or bending or whatnot, but teach it how to stabilize against other movements. That's going to be really a strong foundation for a lot of things that you're going to do from a lifting standpoint, from squats or deadlifts or lunges or even like push-ups and other things. You need to create stability here and not let it kind of dance all around while you're doing something else. So spend time with that. A lot of people don't do this very well. They have very poor positional awareness of their spine, so they have no clue what position it's in, that's a problem. Because even if you brace your abs when you're doing a squat, all the brace does is it secures the position you're in. If you're in a bad position, it simply secures a bad position, right? So our brain is pretty awesome with the things it can do, but it's also very kind of like, it's very basic in the sense that it can't kind of tap you on the shoulder and go, hey, your back's in the wrong position, why don't you move it, then we'll brace. It just braces. You say brace, it goes okay, and it does, which may not help you. So you might think, oh, I'm bracing my abs every time I squat. That's great, but what position is your back in? And if you don't know, it could be in a bad position. So you need to spend time improving your awareness of that position, your ability to brace, and your ability to keep that while you do something else. When the arms are moving, the legs are moving, or something else is happening, you have to be able to control that. Because if you cannot do basic core stabilization movements, then you have about a 0% chance of maintaining that under a load. So start with the basics and then progress through those things. And what would work best if you're doing those things and you bring your squat down, say you're doing barbell squats or even safety bar front squats, bring those back, right? Do some deloaded, do some body weight, do some light goblet squats, maybe even some kind of with a bit of a reach here to help engage the core. But do those things as you're working on the core stability piece. Take the concepts you do from all the core stability stuff and bring those forward and apply the concept to your squats. And then you slowly bring it back to the more challenging versions of it. But you have to do the basics first. If you can't do them in the easiest setup, then there's no way you're going to do it where you're fatigued and under load. You have to do the easy things first. And I think what you'll find though, if you spend some time and dedicate time to doing that, not only is your back pain going to go away, but you're going to be able to lift a lot more weight, right? Because your abs are oftentimes, they're sort of a bridge between the upper and lower halves, and they help to transfer force one way or the other. If they're not doing their job, things tend to get jumbled up in here and they end up kind of backing through here. But if they're locked in, then you can get your whole body top to bottom to generate better tension, which helps you create more force, which is going to help you lift more weights. So sometimes by bringing up the weakest link, which is the middle here, just by doing those things, you're going to find that your deadlift and your squat and those other big lifts are probably going to come up a little bit because you're able to generate more tension. So focus on the basics, bring that concept forward to all your sort of squat variations, and see how it helps both your back pain and the weight lifted go up. One final thing I want to point out is to stop force feeding barbell squats. Okay, it's not a bad exercise. I'm definitely not saying that. However, it's not good for every person. So look at this picture right here. So in this picture, I'm up against the wall, got my arms kind of up against the wall. You need to be able to get into a position very much like this to kind of get under the bar without stressing and compensating right from the setup position. And here's the thing, most people can't. So to me, that is a number one prerequisite. If you're gonna squat with the bar on your back, you need to get into this position. Otherwise, you can't squat with the bar on your back. You can front squat and you can do the safety bar, yoke bar squats, that's fine. But to do the straight bar squat, you have to get into that position first. Because if you can't, right, if you can't get back here, say you're stuck here, you're gonna get under the bar and then you're going to get all kinds of spinal compensations. The head's gonna shoot forward, your back's going to arch just to get into position, right? That means you haven't even done a rep yet. Just to get under the bar, you're in a jacked up position to start. And that's not going to get better as you do a set of 6, 8, 10, 12 reps under the bar. It's not gonna improve by the end. It's going to get worse. Remember, I talked about in the previous video, your abs are kind of a bridge between the lower and upper. Well, if I've got my back in this ridiculous arch, my head is forward trying to compensate for my lack of shoulder range of motion, that squat's gonna beat the hell out of your back. There's no two ways about it. In addition to putting a ton of stress on your shoulder, elbow, and neck too, but that's a different topic for a different day. The fact of the matter is, if you can't get to that kind of wall position comfortably and hold it there, right? So think about how long a set might take you to do with your squats. We'll just say 30 seconds, just as an easy number. Get up against the wall, hold it for 30 seconds. What happens? Do your arms go numb? Like, what do you feel? Because again, not everybody does well with that position for a number of different reasons. But the point is, if you can't get there and you can't hold it there, then you really have no business under the bar doing back squats or squats with the bar on your upper back here. You can definitely front squats, no problem. Yoke bar, no problem. Goblet, no problem. But the barbell squat seems to be this thing that people feel obligated that they have to do it in some way, but not everybody qualifies to do it, and it's not a good exercise for every single person. If you're having back pain, I would absolutely take that away for now, change that up. Try a different kind of a squat, work on the other technique things we found, and I think you'll find that maybe just for you, removing the bar from your back and moving it to the front or doing a different kind might be all you had to do to start getting out of low back pain.